Today, we'll be talking about how we can understand the landscape of cybersecurity and data privacy for the healthcare sector. So, nowadays, you might be aware that there are plenty of cyber attacks occurring in various sectors, and healthcare sector is a very sensitive area, and the hackers or any you know persons or people or groups with vested interest try to attack the healthcare sector because it is considered to be the backbone. Because after all, we know that health is wealth, and whenever people try to attack such sectors, then the impact is felt all over the economy because each and every person needs proper healthcare. And I'm talking about healthcare sector uh, pertaining to the hospitals or the pharmaceutical companies or the health insurance organizations. So each and every company or organization which is associated with the healthcare sector is prone to such kind of cyber attacks nowadays. So I'll be sharing my screen, and I would appreciate if you can kindly confirm that my screen is visible and my voice is clearly audible. Is my screen visible and my voice audible? Yeah, okay. So our topic for today's webinar is leveraging cybersecurity and data privacy for the healthcare sector. And we'll be trying to understand that how we can actually, improve the cybersecurity landscape of the healthcare sector. And we'll be covering various points and interesting agendas while covering through this webinar. And we'll also be having few interesting exercises which we'll be carrying out while uh, this session is going on. So let's talk about cybersecurity first. So here, mainly cybersecurity talks about the practice of protecting computer systems, networks, and data from unauthorized access, damage, or usage. So this definition can actually throw some light on the importance of cybersecurity across all these sectors, right? So it involves a combination of technologies, policies, and various procedures to mitigate and combat cyber attacks and protect the sensitive information. Now, in the case of the healthcare sector, the sensitive information is very important because we are handling with electronic health records, electronic medical records. So this kind of data sets are very important. And the need to save and protect this kind of data set is very, very important. So the cybersecurity looks after ensuring the CIA triad, that is confidentiality, integrity, and availability of the digital assets. So first of all, when suppose in a hospital, we are trying to ensure that the electronic health records or the patient health information is kept confidential, the data maintains its integrity, and also it is available to the correct users, the correct stakeholders, or the authenticated stakeholders of that specific hospital or any pharmaceutical company or the health insurance organization. So this healthcare data privacy refers to the practice of safeguarding, protecting, and controlling the collection, storage, usage, and sharing of the patient health information or the personal health information to ensure it is handled responsibly and in compliance with the data protection laws and the ethical guidelines, which maintains a proper protection of the data, and it will be only be used as per the needs of that circumstance. But while using that data set also, we'll maintain proper standards so that the cybersecurity perspective is always maintained. Now, let's talk about the COVID-19 pandemic. So, few years back, we faced a big coronavirus crisis, which rapidly transformed the technological system. For example, you might be aware various companies provided work from home opportunities, and nowadays also there are various IT companies who are supporting the hybrid mode. In various institutes also, we witnessed that online classes were being taken. For example, let's take our today's example. The Zoom platform was there from before, but we started leveraging it when the need arose, that is, during the COVID-19 pandemic. So, similarly, these digital health, health informatics, telemedicine, and various other platforms came into the game. Although these technologies were there from before, but they were used and they percolated into the real health systems in the day-to-day public health systems because their need arose. So this is how we actually try to leverage the technology and also try to enhance the technological aspects with the help of cybersecurity. So let's talk about what's the current scenario of the cybersecurity in the healthcare sector. So uh, we know that cybersecurity and data privacy have become an essential aspect of concern, a very important point of concern for the healthcare sector, because it has been seen that especially after the COVID-19 pandemic, when the health systems, the healthcare sector, the hospitals, pharmaceutical companies, or the medical research based organizations started moving towards the management information systems, that is the IT systems, they embedded and also brought in various hardwares, computer hardwares, and softwares to run their day-to-day organizational activities. Then it became a point of concern because it made the work easier for all the stakeholders of such companies, but it also, gave rise to a point of concern, that was cybersecurity, because cyber attacks also started, being done on such kind of organizations. For example, we all know about AIMS, which is a
Dr.
top
Sarthak,
medical institute. Yeah.
are you changing the slide because we are
Yes, ma'am.
just seeing the first slide?
Yeah, I'm changing the slides.
Can
Yeah,
you put
one
it on
second.
the slideshow mode?
Yeah. One second.
Yeah.
One second. Thanks for saying. I mean, just one second. New share. I'll just share the entire screen then. It'll be better, I think. Yeah. Um, yeah. Are my slides visible now?
Yes, Dr. Sarthak.
And it's
Thank you.
changing?
Yeah.
Thank you so much, ma'am. Thank you. Yeah, sorry for the inconvenience. So basically, now we talk about cybersecurity, and as we can see that lots of cyber attacks are being faced or being suffered by various kind of companies. For example, we know about AIMS Delhi. This hospital faced a ransomware attack in the year 2022. Again, the Pharmaceuticals, a very famous pharmaceutical company, faced a ransomware attack. And then the Indian Council of Medical Research also suffered a data breach in the year 2023. So we can see that it's an essential need to enhance the cybersecurity landscape of the healthcare fraternity, along with the hospital systems. That is, we talk about the HMIS, the hospital management information systems, as well as the pharmaceutical sector. And it is actually the need of the hour, because we know that first of all, necessity is the mother of invention. So people are using IT systems, information technology into all types of organizations. But cybersecurity is also the need of the hour, because whenever embed, incorporate IT into the game, then a common agenda or a point of concern which arises is the cybersecurity aspect. So let's dig deeper into understanding the fundamental concepts of cybersecurity, information security, data privacy, so that all of us are on the same page and know that what can be the critical aspects of cybersecurity. So, in the case of information security, we can see it basically talks about preservation of the confidentiality, integrity, and availability of the information. So, basically, it talks about four R's. There are four important R's of information security. So, I hope my slides are changing and it's visible clearly, and my voice is audible.
Yes, sir.
Thank you so much. I really appreciate. So here I can see that, as all of us can see actually in the slide, that we have a point here called right information. So here, as we can see, that right information is very much needed in case of such companies pertinent to the healthcare sector, because it's a game of information. Suppose a patient enters in a hospital and gets admitted and then gets diagnosed and then gets discharged. So in this entire process, a proper chain of data is created. So maintaining the accuracy and the completeness of the information is very much needed, because that will provide a correct data set for that specific patient health information, right? Then we talk about the right form. So we need to provide the information in the right format. For example, a doctor wants to check what are the major symptoms being faced by most of the patients admitted under that doctor. So, in that, this data will be coming in a form of maybe a pie chart. Okay, so in the pie chart, it might be shown that most of the patients are facing a common symptom related to maybe diabetes or maybe any other disease. So this is talking about the right form of the data. Then time we talk about accessible and usable upon demand. So let us take this simple example of a doctor. The doctor wants the information of the patients, whoever is admitted under him or her. So he or she wants the data within few seconds. So it is also available in the right time as per the database management system, which is connected to the hospital management information system. And then we provide data only to the authorized individuals. So the data which we are talking about right now, that the patients who are admitted under a doctor, cannot be accessed by the patient or any other guy who is maybe not related to the hospital. So this data will only be provided to the doctor, who is an authorized individual, and they can access the data correctly, right? So now let us talk about what kind of cyber threats are there, right? So uh, when we talk about the types of cyber threats, so let's talk about the most common cyber threat which the hospitals or the pharmaceutical companies, or actually any organization, it can be IT company also, they normally face is, as we saw, that AIMS faced a ransomware attack. There was a data breach in ICMR, and Sun Pharmaceuticals and various other companies are facing cyber attacks day by day. Okay, so let's talk about what are these types. Let's dig deeper into this. So we can see here, let's talk about first hacking. Now, what's hacking? Hacking is basically a hacker gets access to the computer from a remote end. So suppose in a hospital, a hacker gets access to the main computer which stores the health records or the patient health information, then obviously it's a point of concern. So that is called hacking. Then we talk about denial of service and distributed denial of service. So this basically, these are called as DOS or DDoS attack. So in the case of a DOS or DDoS attack, it talks about that a computer tries to flounder with this remote computer by preparing a denial of service attack. So as the name suggests, denial of service talks about when a DOS attack occurs in a specific computer, maybe in a pharmaceutical company, then what happens? The computer becomes unstable. As the name suggests, denial of service. So the end user who is actually using the computer cannot use the computer properly because there has been a DOS attack. And then what's DDoS attack? In DDoS attack, what happens that multiple computers from multiple location tries to attack a computer system. That is, I mean, in this case, it attacks, maybe a computer system located in a hospital or maybe located in a pharmaceutical company. So the server is attacked by distributed systems. So you can easily understand that in the case of a DDoS attack, it is more tough to understand that, and mitigate or combat such kind of cyber attacks. Then we talk about phishing. Now, phishing, before talking about phishing, let's talk about phishing. A normal fishing, what we do, a fisherman is, while doing fishing, puts a bait on the fishing net and then drops that fishing net and rod into the river or the water body where he or she wants to catch the fish, and the fish sees the bait and then gets captured into the fishing net. So in phishing, what happens the hacker creates a page which looks similar to the original page. Maybe, for example, there is a online patient admission system created by a website which is pertinent to a hospital. So there is a hospital website which provides a facility to the patients that they can fill that form to get admitted through a internet. Okay, so now in case of phishing, what happens that suppose a hacker creates a similar web page which looks completely same as the original hospital website's page, which talks about filling the data sets in the admission form. Then the patient tries to enter all the data in that form, but actually that page has been created by the hacker and is not the original page. So the data is stored in that admission form and the entire data is passed on to the hacker. So that is called phishing. So be very careful. Reason behind I'm saying you all this, obviously we'll be coming down to the good practices to avoid such kind of attacks. So first we need to know the virus, then we'll talk about the antivirus, right? So first we need to know about the cyber attacks, and then we'll be actually talking how to avoid and combat such cyber attacks. Then we talk about credential stuffing. So what happens, like in many cases, we find that most of the people, and it's a common practice, use similar or same kind of passwords over all websites. So if one website's password is leaked, then the hacker tries to use credential stuffing to manipulate and get access to the other websites also with the help of the required credentials. Then we talk about malicious code. In case of malicious code, this code basically, acha, in computer, what happens? A computer virus, is different from a coronavirus. Okay, a computer virus is actually a code. It looks like a simple program, but when you run it or when it automatically runs in the system, it creates nuisance. That is, it tries to hack into the computer. So a malicious code is a code which, when executed, can actually hamper the computer functions, and obviously it has malicious intents. Then let's talk about Trojan horse. Horse is also like a malware, but there's a story behind Trojan horse. Trojan horse, this story comes from the Battle of Troy, where the army couldn't actually break into the castle, right? So they found another way. His After trying multiple ways to break into a castle for invasion, they couldn't break into it. So at the night time, they actually you know built a big Trojan horse, and on the next day in the daytime they gifted this big Trojan horse, which is a big wooden horse, to the king, staying in the castle which they were trying to invade. And then this Trojan horse was kept inside the castle, and in the night time, again in the next night, the soldiers who were actually hiding inside the Trojan horse, a big wooden horse, they came out of the Trojan horse and invaded the castle because they couldn't break into the castle walls from outside. So they break in from inside. So from there, the name Trojan horse came. So this Trojan horse is like this Trojan horse virus looks like a simple software code, right? A executable code. And if you see it from outside, I mean, and from the front end, you will not understand that this is actually a malicious code or a malware or a virus. But yes, it can do damage to the computer because after all, its main agenda is to hack into the computer. Then we talk about ransomware. In ransomware, what happens? Like it is again a kind of hacking where a cyber attack occurs, and then the hacker demands for ransom, that is money in cash or kind, or any other way. And when the money or the cryptocurrency or any transaction is made based on the demands of the hacker, then again the computer is brought back to the originally stable state. Then we talk about the advanced persistent threat, a very interesting one. In this case, what happens, like the hacker or the person with vested interests is already there in the system, and the his or her main agenda is to steal data from the organization. So in this case also, it's an advanced persistent threat. So with time and with various opportunities, this hacker or the team of hackers tries to steal data from the organization. Then we talk about internal threats. In internal threats, what happens? There can be disgruntled employees or contractors or vendors who have maybe some problems with that organization. They also try to breach into the system, maybe by getting some data or maybe stealing some data and then selling it to maybe a computer hospital or a pharmaceutical company or any other organization. Then we have lack of employee security awareness, very important thing. So that's why this webinar will actually help you, in becoming a cyber warrior, or at least a person who knows about cybersecurity, because it's the need of the hour. In any company you work, this common types of cyber threats will be prevalent in each and every organization. So that's why you should be very much careful about such kind of nomenclatures and topics. So, in the case of lack of employee security awareness, what happens that in many cases it can happen that maybe the person is not that tech savvy or not that much knowledgeable about cybersecurity. So, the it is the duty of that organization also, the hospital or the pharmaceutical company also, to make the stakeholders, the employees, understand that these are the primary concerns of cybersecurity. This can be the types of cyber attacks, and these are the good practices which we're going to discuss in our upcoming slides, that these should be maintained so that the cybersecurity landscape of that specific organization is safe and it is secure from cyber attacks. Then we talk about social engineering. Social engineering, what happens, as the name suggests, that suppose an internal employee or a person who is actually a vendor or maybe having a collaboration with that organization or a hospital tries to do social engineering. That is, first tries to gain the trust of the stakeholders or maybe the database administrator, and then gradually tries to percolate into the system by finding some confidential information or credentials. Okay, so let's, before trying this, let's, play a simple game just to, understand how, we can do some real-time polls as well. So first of all, I'll be asking a very simple question. That is, I mean, how are you? So just so that you guys are, aware of this Mentimeter platform, and then we'll be asking an interesting question related to cybersecurity accordingly. Okay. So I hope actually I've shared my entire screen, so I hope it's visible.
Yes, sir.
Yeah, even the Mentimeter page is visible.
Yes, sir.
So this is a very yeah. So this is a very interesting platform where we can do a real time polls. Okay. So I would request each and every participant just simply type menti.com in your smartphone or laptops, and then just enter this code which is provided here, 41269728, to get access to this poll. So it's a very interesting one, and you can see in real time, whenever you provide your responses, the polls will show real time results as per your responses, actually. So I would request each and every participant if you could kindly join at menti.com and then use the code and then start providing your responses. Excellent. So here you can see, I mean, how nicely the participants are responding. I really appreciate all the participants. So everyone is fine. That's good to know. So So it's a very common question. So obviously everyone should be fine. That's great. So this was just a demo because then we'll be asking about a question related to cybersecurity, and then we'll again come back to our presentation. So this is how this interesting tool Mentimeter works, and it's a very nice one. Okay. So thanks for your kind responses, and obviously keep responding by typing this code. You can note it somewhere. It's 41269728. And now what I'll do is I'll also write in the chat box. It will be easier for you. Just go to menti.com and then use the code 4126. I've also posted about the website and the code to enter into the website in the Zoom chat box. I hope my entire computer screen is visible because I have actually changed another website. So, can you guys see about a website called Cyber Peace Institute?
Yes, sir.
Is visible?
Yes, sir.
Excellent. Excellent. So, this is a very interesting website which talks about cyber incident tracer, and it talks about, you know, so many cyber attacks which have occurred in the healthcare sector across 43 countries during the COVID-19 pandemic, actually. So here you can see this is how, this website has, taken a note of all the cybersecurity incidents which occurred over the healthcare sector, right? So let's see and explore here that if we see this world map here, you can see that plenty of cyber attacks have occurred, in United States and the European Union, also in India. Okay, so why not we just see the cyber attacks which occurred in India so we can play with it as well and then try to find, see here. In India, these were the cyber attacks. Here you can see these cyber attacks occurred across the healthcare sector. So it can be a hospital, a pharmaceutical company, or a medical manufacturing company. Okay, so here let's talk about the incident types. So you can see here the major thing is that most of the attacks were found to be ransomware. See, you can see it here as well. See, can you imagine? Out of this 501 incidents, 427 incidents were from ransomware. So you can see, if we see it in the world map as well, that ransomware attacks were prevalent across the world, right? Because in this case, I hope you remember this. In this case, what happens? See, if we click on this button by incident type, then you can see here is that ransomware was very much prevalent across the world. And you can see also malware DDoS, that is distributed denial of service attack or DOS attack. This was also prevalent, but very less. The major attack which occurred across the world was ransomware. Okay, so that's a very important point of concern because you might be aware we just discussed about ICMR. Even ICMR also faced a ransomware attack, right? And they also faced a data breach also. And in many cases, what happens whenever these companies face a attack, maybe a data breach, after that the hackers asks for a ransom, and it goes towards a ransomware attack. Now let's see about sector wise. Okay, if we talk about pharmaceuticals, so you can see here in case of pharmaceuticals also, as I'm clicking on this filter, you can see that these are the types of attacks which occurred, which were faced across the world. So again, we can see here ransomware is an attack which needs to be focused upon, and it's a really a big point of concern. Now, let's talk about the targeted organizations. So here you can see this is like a tree map chart. You can see here, and I hope the screen is clearly visible to everyone.
Yes, sir.
The website,
Yes, sir.
and
Yes,
I'll
sir.
also share,
Yes, sir.
yeah, and I also share this website. Thank you, ma'am. And I also share this website in the Zoom chat box so that everyone can have a glimpse of it. Okay, one second. I'll just share this. Acha. Uh, I have shared a link now. If you can kindly click on that, this page will open. Okay, this page. This page opens up, and here you can simply click on access data and then get access to this interesting tool which talks about the 501 cyber attacks which occurred across the healthcare sector in 43 countries. Can you imagine the impact of such cyber attacks? Okay, now let's talk about another interesting thing. Now, suppose we were seeing a visualization of the data set collected, but here you can see a tabular form also of the entire data set collected. Here, if you go to collected data and if you go to data visualization, then obviously you can see about the data's visualization based on the data set collected. So you can see obviously here it goes without saying, as we already discussed, is that it talked about the cyber attacks which occurred during the COVID-19 pandemic, because that time there was a massive surge in the number of cyber attacks in the healthcare sector. So you can see that in July 2020, this incident started, and then in near 2021 October, there was a massive rise in the number of incidents. That is also a point of concern. So, so reason behind showing you all this is just so that you can understand the importance of cybersecurity in the healthcare sector. And then we're gonna move to our next question: is that which is the most common cyber attack within the healthcare sector? Obviously, I mean, uh, you can use your own knowledge and also the knowledge gained from this session, and then kindly provide your inputs here. Obviously, very good. Phishing is also an important one, because in news many cases come for phishing, because maybe a phishing link has been sent to the doctor, nurse, or maybe a pharmaceutical manufacturer, and then important confidential data has been taken and accessed by the hacker. And then obviously ransomware we already discussed, and we also got a glimpse of the ransomware attacks which occurred across the various healthcare sector based companies. And then we see malware, also a very important one, DOS and DDoS also. So obviously you can provide your points, and you can see how beautifully you have provided your responses, and it is being shown here in the real time in Mentimeter. So I really appreciate all the participants, and your kind cooperation and responses also. I really appreciate your responses. So here you can see how ransomware is going towards maximum, you know, because ransomware is a very common attack in the healthcare sector, because in most of the cases the hackers have their primary agenda of earning few bucks of money, right? So they ask for ransom. And then the main problem in such cybersecurity landscape is that even if a cyber attack occurs and the ransomware attack is done, and then the hacker asks for ransom, after that, even after paying the ransom also, the main point of concern is, actually has the hacker deleted the original data set or not? Okay, or uh, the computer is brought back to a stable state, but does the hacker again keeps a backup of the data, and maybe in the near future again that same hacker can actually generate a ransomware attack on the healthcare sector or not? That is also a very big point of concern. So that's why we have to be very careful. We shouldn't share personal data anywhere without proper investigation or proper validation. And also, we need to be very careful in clicking various links which come from various sources. And we also should be very much careful about clicking on unknown files which can be executable files and maybe hamper the system, right? Okay, so now uh, let's come back to our presentation. I hope my PPT is visible. It talks about HIPAA, Health Insurance Portability and Accountability Act.
Yes, sir.
Excellent. Okay, so now what happens, like, the legal aspects always had a, you know, saying that there is a saying that there is always a room for improvement. And this has been, very much prevalent. And it is reflected in the legal aspects of the IT or the cyber laws as well. So let's talk about first HIPAA, that is Health Insurance Portability and Accountability Act. It was enacted in the United States of America in the year 1996, but still amendments are going on, and all types of acts, laws which we'll be discussing now has a room for further improvement and amendments as well based on the current scenario. So this HIPAA is a very crucial piece of legislation in the healthcare industry. And in response to the changing healthcare landscape, this HIPAA was actually introduced based on the needs of such IT, infrastructure, which were being, used everywhere in the US healthcare system. It's almost completely automated, and they have a very good healthcare landscape. Although lots of improvements are still there in any health system, that can be from US, India, or Russia, European Union, Japan, or any other country. There is still a lot of room for improvement in the healthcare sector, because, as we were discussing, that necessity is the mother of invention. Healthcare sector was doing very well, but when the pandemic came, it actually disrupted the systems. Just like in our education also, we started using Zoom, Google Meet, and online platforms. The healthcare system also, the concept of telemedicine was there, but it was widely used during the COVID-19 pandemic, because a major point of concern for the doctors were they at least knew about how to cure a patient, or at least provide a, solution which can actually keep the patient, alive. And then obviously thanks to all the scientists and the healthcare sector for bringing out the vaccines, so most of the people were saved from the coronavirus crisis. But the percolation of telemedicine, the IT infrastructure was actually rapidly witnessed during this coronavirus crisis. So, in response to this changing healthcare landscape, the HIPAA has introduced various kinds of privacy and security concerns. So, the Health Insurance Portability and Accountability Act is actually a national standard that protects sensitive patient health information, and it also protects it from being disclosed without the patient's consent or knowledge, because obviously it's the personal information of the patient. So that's why this kind of health information is being disclosed, you know is not disclosed without the proper consent or approval of the patient, or at least the patient knows that, suppose for example, a patient enters into a hospital, gets diagnosed, and while getting discharged, the patient requests that obviously he or she has a health insurance plan, and they can, clear the bill from the health insurance service provider. So in this case, obviously, the hospital's gonna share the patient's information, health information, with the health insurance organization, and then obviously necessary, checks will be done, evaluation will be done, and then obviously the hospital will be paid by the health insurance service provider. So in this case, we need to ensure that the individual's health information is properly protected. So obviously, the hospital's gonna share the information with the health insurance company, but they will also provide the information to the patient also, that your information is being shared for verification purpose, so that the bill is cleared accordingly, right? So the proper flow of information is very much needed, and this promotes high quality healthcare, and it also protects the public's health and well-being. So, who must comply? So, every healthcare provider who electronically transmits health information in connection with such certain transactions, this transaction which we discussed is also coming under this transaction. Then, health plans, health insurance plans, healthcare clearinghouses, and business associates that act on behalf of a covered entity, including the claims processing. I mean, insurance claims can be, or data analysis, or utilization review and billing of the hospital billing also comes into this purview. Acha. Now we are talking about the US healthcare landscape on the basis of HIPAA Act. Okay, Health Insurance Portability and Accountability Act. Now let us talk about the European Union atmosphere. Okay, so they also have a regulation called General Data Protection Regulation. In this case, what happens? That in the case of GDPR, what happens? The EU's General Data Protection Regulation defines the personal data as any information related to a person that can be used to directly or indirectly identify them. Okay, so it is protecting the entire personal data. So I hope it, you know, makes you understand that this GDPR is applicable in various sectors, right? So in this case, suppose the location data, you might be aware whenever in your smartphones you switch on the location, in few applications like Ola, Uber, you need to switch on the location setting, then only you can access to that app, right? So that is also your personal information. Please understand, because you are, located in a location. It can be a remote area, a rural area, an urban area, or any public place, private space, but it is your private own personal information. So that protection is also very much needed. Then name, physical attributes, maybe the identification mark in your body, which is noted or mentioned in your iCard. The health information, maybe your blood pressure level, or maybe your heartbeat, or maybe in a simple smartwatch also, whatever data is being stored. And you might be aware, you connect your smartwatches with your applications also. So in that case also, we should be careful that the application where which is managing our smartwatch is also free from such cyber attacks, or we should be very careful in maintaining the cyber security of such data sets. Then economic, culture, or social identity of a person, and then identification number, Aadhaar card, Aadhaar number, then online identifiers, IP address, MAC address. Okay, then in a phone number, the phone number, the IMI number, these are also personal information. So this protection is being provided by the GDPR. Now I'll tell about an interesting concept here, is that what is the territorial scope of GDPR? Okay, just like in HIPAA, we talked about US. In GDPR, we are talking about European Union. Okay, the countries who are actually in the European Union. So EU-based organizations that collect or process the personal data of EU residents, European Union residents, are obviously coming under the territorial scope of this GDPR. But the organizations who are situated outside, I mean the organizations who are geographically situated outside the European Union, but are monitoring the behavior or offering goods, products, or services to the EU residents, they are also coming under the purview of the GDPR. Make sense? Because actually, they are also handling the personal health information, or the patient information, or any stakeholders information who is actually a resident of the European Union based country. So, in spite of that company may be located in India, or maybe in Hong Kong, or maybe in Malaysia, or maybe in Japan, or maybe China also, but if they're handling data sets and providing services to the EU residents, then they are also coming under the territorial scope of GDPR. Okay, now let us talk about the legal aspects from the Indian perspective, but we'll be talking about the IT cyber laws, right? Mainly. So let's talk about an interesting act which came in the year 2000, and a very interesting one, that is Information Technology Act. It was very important, and it was actually a comprehensive legislation that provides legal recognition for the electronic records and data. So these are like, these laws and acts came years back. Okay, but obviously we'll be talking about DPDP in our upcoming slide. But before that, we need to actually know about the evolution of the legal aspects and how our Indian government also tried to develop the information technology landscape by providing suitable laws, legislations, acts, regulations, guidelines, rules, protocols, so that the cybersecurity landscape also develops in our Indian atmosphere as well. Then we talk about the Clinical Establishments Registration and Regulation Act 2010. So this act focuses on the registration and regulation of the clinical establishments. That is also very important because obviously whenever a clinic is established, a specific set of acts are also provided. Now these acts are being discussed here because they are pertaining to IT and the healthcare sector. That's why. Now let's talk about telemedicine. Now, see, that's why we say that necessity is the mother of invention. We can see here a burning example. Telemedicine practice guidelines, which came in the year 2020. That was the year when actually COVID-19 pandemic was already there. So the telemedicine practice guidelines provided guidance on the practice of telemedicine, and it included various provisions which related to data protection and patient privacy. Then we talk about EHR, electronic health records. Okay, standards for the exchange of health information rules. Okay, these rules provide standards for the exchange of health information and electronic health records, and they also include provisions for maintaining the data privacy and also the cybersecurity aspect of the electronic health records. Now, let us talk about the DPDP Act. That is also a very interesting one. And this is actually currently the main act which percolates and surrounds over this cybersecurity perspective. And obviously it has a major say in the healthcare sector, because in the healthcare sector people are handling personal data, patient health information, electronic health records, electronic medical records. So in this case, the DPDP Act 2023 is actually a comprehensive data privacy law which helps in regulating the processing of digital personal data. Okay, so obviously the DPDP Act is applicable in other sectors also, but as our current topic of interest is the healthcare sector, that's why I'm talking about the hospitals, EHR, EMR, the pharmaceutical companies. Okay, but this DPDP Act is actually applicable in various sectors, whichever is handling digital personal data. So it balances the rights of the individuals to protect their personal data with the need for lawful data processing. Okay, so what happens? Like it tries to understand that these are the individuals and their data, personal data is very very important. So it is taken into higher priority, and then proper legal data processing is ensured so that even if it can also happen in the case of India that a patient enters in a hospital and then gets admitted, diagnosed, and the process remains the same, and then accordingly gets discharged, right? But in this entire process, again the patient wants to claim the hospital bill to be cleared by the health insurance organization. So again, obviously the hospital is going to share that data with the health insurance provider, and then accordingly verification will be done, and the hospital bill will be cleared by the health insurance service provider. So the draft digital personal data protection rules 2025, this year itself, aims to operationalize the act which were published for public consultation. Okay, so please understand that this DPDP Act, as it's a new one, the feedbacks and the inputs of the citizens were also taken. We all, gave our team also, like we were working on a cybersecurity project. So obviously, we many people across the country provided their feedbacks and inputs. So the policies of Government of India are also aimed at ensuring safe, trusted, and accountable cyberspace for all types of users. Obviously, these users can be a patient, or maybe a person who is actually working in a pharmaceutical company, or even the doctors who are working in the hospitals, and also the persons who are actually working in the health insurance organizations, or any organization in the healthcare sector, and also in the other sectors as well. So these policies are actually pertaining and serving all types of citizens of our country. So the capacity building and awareness are important components, because what happens, like, see, you might be aware that there are various facilities, applications, and support being given by the government. But it is also needed that a proper awareness mechanism actually makes the citizens aware that this facility is already available in the market. It has been provided by the government, so use it, leverage it, right? So regular training programs are also conducted across sectors to build these IT security skills among various officials and professionals. And obviously, there are various kinds of public awareness campaigns, like cybersecurity awareness month. And the best part is, like, the cybersecurity awareness month is going on now, and we are having this webinar. So it is again a coincidence, and I really appreciate your kind participation. So we need to ensure a safer internet day and promote online safety and a secure digital transactions, and also maintain cyber hygiene. Okay, so for this also we need to make the people aware, because please understand, no one wants to get hacked, right? Okay, so everyone, if they are made aware, then obviously they can also have proper hygienic practices. For example, whenever you go to a food stall, you always at least check that the food being prepared by that shop or that restaurant is hygienic or not. At least you try to check, right? Similarly, in the case of cyber hygiene, we always need to check that, obviously, for example, you do not insert a virus affected pen drive in your laptop or your computer or your institutional computer or your organizational laptop. You cannot, right? So you shouldn't actually. So even there are various companies who have actually such protocols. If you insert a a virus affected pen drive, it generates an alarm, and obviously it tries to ignore that pen drive and does not read it. But what happens if it reads it? And if it reads the pen drive and the virus is percolating from the pen drive to the computer, then obviously, if the computer is connected with the organizational server, so just understand, just because of a simple small pen drive, the entire organizational server gets affected, right? So we have Cyber Shakti program, which was launched in October 2024, just previous year, which aims to build a skilled women workforce in cybersecurity. Then we have ISEA, Information Security Education and Awareness Programs, where there were many workshops being conducted, and it reaches to various participants, lakhs and lakhs of participants, people, men, women, academia, law enforcement agencies, government personals, and the general public, so that they're aware of the information security. Then we talk about multilingual awareness materials. What happens, like, if we want to make a person aware of cybersecurity who does not know English, what to do then? Then obviously we can have the multilingual awareness programs based on the regional language of that specific village or that specific city, where the regional language is, maybe, for example, let's talk about creating an awareness campaign for the people staying in a village in Karnataka. So we have a Kannada based awareness material, which can be a handbook, a video, a poster, advisories, which are widely disseminated among the population, so that they are made aware based on the awareness campaigns. Now let us talk about the trends in the information security threats. So what happens, like, nowadays, the main point of concern is that, just like the organizations, the hospitals are also using HMIS, IT infrastructure, hospital management information systems, and the pharmaceutical companies are also using innovative technologies to build innovative drugs, and also trying to percolate IT infrastructure into their systems, control the entire organization through the laptop or the computer with the help of maybe another MIS, a management information system, which helps in running the pharmaceutical company. So just like technology is developing and improving in such organizational atmosphere, the technology is also improving in the hackers atmosphere. The hackers are also getting access to various advanced tools. For example, automation of attack tools. Nowadays, a major challenge is automation. What happens? AI is obviously a boon because it is being used properly, but it can be a bane as well. I mean, because reason behind any innovative or disruptive technology can be a boon or a bane, provided how we use it. So it is our goodness that we use it properly, but some hackers might have evil interests. So what they do, they try to automate the attack tools. For example, they develop an algorithm to hack into a website. So there is a term called SQL injection, structured query language injection. So in that case, what happens? You might be aware that various websites are connected to a database because, for example, we talk about a hospital website. Suppose in that hospital website, if credentials are provided correctly, then it get access. Then that stakeholder or the end user get access to the hospital database. Now, suppose someone wants to create an algorithm which can provide a random password generation. Okay, so with the help of various permutation and combination of passwords, and by automating this process, what happens? The hackers try to get access to the hospital's database by automating the system. That is, automatically various permutation and combination of passwords will be generated and tried like a hit and trial method, and then the the cyber attack is done. Then we talk about attack tools that are difficult to detect. Okay, that is also a very important thing, because there are various I hope my voice is audible clearly.
Yes, sir.
Yeah, okay, okay, thank you. Yeah. So, in the case of the attack tools that are difficult to detect, that is also a very important thing, because nowadays what happens, just because of the rapid percolation of AI, you might be aware of generative AI. We use ChatGPT, Copilot, Gemini AI. So the AI tools are also generating such new ways of hacking mechanisms that it becomes difficult to detect for the system also, because they actually see what happens in case of an antivirus. Let's talk about an antivirus. What happens here? An antivirus tries to scan the entire computer. Whenever you run an antivirus scan, for example, you have a Norton or a Kaspersky or an Avast, McAfee, or Sophos, or any other antivirus system. Whenever the scanning starts, what happens? The vulnerabilities are discovered based on the database of virus which is stored in the antivirus. But suppose you might be aware that just like each and every day a new kind of technological aspect is coming up, a new kind of virus, a computer virus is also coming up. So understanding those computer virus is also very difficult for the antivirus, right? So it becomes sometimes difficult to detect. Then increasing asymmetric threat and convergence of attack methods. Now, what is asymmetric? In this case, asymmetric is that suppose the hacker has an edge over the database administrator or the cybersecurity person who is sitting in the company. So it is an asymmetric threat, because now the cybersecurity officer or the database administrator who is sitting in a hospital's system to manage the database or to ensure that the cybersecurity is maintained, he or she is not aware of the attack which is gonna be done by the hacker. So it is kind of asymmetric threat. So the hacker gets an edge over the database administrator or the cybersecurity person. So such kind of convergence of attack methods is also a point of concern. Then we talk about increasing threat from infrastructure attacks. What happens? You might be aware that in the Russia-Ukraine war, what happened? Russian hackers and Ukrainian hackers also started cyber warfare, many years back. we came to know about the war because then they started taking out tanks, missiles, and then people saw in news that something is happening. But they were into Cold War, a few years back because they were into cyber warfare, maybe hacking into a nuclear, nuclear facility, or maybe hacking the, factories, or maybe hacking the defense systems. So this kind of infrastructure attacks is also a trend which has been witnessed. Then changes in the purpose of attacks. Any hacker might be, hacking for some money, cash, kind, ransom, or maybe a hacker is maybe disgruntled, maybe is a disgruntled employee who left the organization and then trying to attack into the organization. So obviously that is a major point of concern because that ex-employee already had lots of data sets of their company, but maybe they couldn't take those data. But you never know how the hacker gets access to such kind of data through various mechanisms. Acha. Now let us talk about, till now we were talking about the problems. Now let us talk about the solutions, which is the most important part. So just like there are, various layers help you in, improving something. For example, let's talk about a table. A table with, various layers is obviously will be more stronger than a table with a single layer, right? So similarly, in this defense in depth model, there are three layers. Okay. In these three layers, one is for this prevention. I hope my mouse pointer is visible, right? You can see my mouse pointer, dear participants.
Yes, sir.
Excellent. So here you can see this is the first layer. Okay. That is prevention. Okay. Then we have detection, and then we have tolerance. So what happens in the case of prevention? There are various prevention technologies which actually tries to prevent any cyber attack from occurring. Okay. But if the cyber attack occurs and it, you know, passes this prevention layer, then we have the detection layer. Okay. And then we have the tolerance layer. So what happens? This is a dynamic or active defense mechanism, which is a layered protection. Okay. In this layer, for example, let's talk about a simple shoe. Whenever you have a layered shoe, you have cushion there, and then over that you have actually another cover. Why these are provided? So that your legs are safe while you are walking, right? So similarly, there are plenty of layers also in the defense in depth model, because in the case of prevention, whenever various kinds of cyber attacks occur, so obviously the prevention mechanism, which we'll be discussing in our upcoming slide in detail, they have various good technologies. Very much effective technology, but still if it breaches, then they have a detection layer and then a tolerance layer, so that none of the cyber attacks actually reach to this third layer, or at least cross this third layer and they damage the system. So that is actually defense in depth model. So it's a three-layered protection, that is prevention, detection, and tolerance. Okay. So let's talk about the prevention technology. Okay. So what happens? You guys are aware of a saying, prevention is better than cure. So obviously, the best thing is prevention. Just try to avoid such kind of attacks. So we have cryptography, cryptanalysis. So what is this cryptography? In simple language, I'll tell you. I have a number 123. Okay. Now I want to pass on this information to you guys. That is, the number is 123. Right. Now I will not say directly 123 because I'm in a public domain. Right. So what I'll do, I'll tell you. Yes. Any queries, please? Okay. So, yes. Feel free to ask any queries if you have. Is there any query?
There was a question, sir, from Ravi.
Yeah. So shall we take the questions now, or maybe
no, we can take it
after
in the
this?
end, sir. We can take it in the end.
Sure.
Thank you, sir.
Has he posted in the message?
Yes, sir.
Okay. We'll just get back to your questions. We're almost done, and then we can get back to the questions. Okay. So now we have the prevention technology. In this case, suppose I want to pass on a number 123. So I will tell 567. That is, I'll pass on this information to the receiver that just subtract each and every digit by -4, so that you can get the original number. So for passing on the information regarding 1 to 3, I tell you 6, 7, 8. So 6, 7, 8, every digit, if you do minus 5, 6 minus 5 is 1, 7 minus 5 is 2, 8 minus 5 is 3. So the actual number is 1, 2, 3. So what I did encryption. I encrypted the 1, 2, 3 number into 6, 7, 8 and then passed on that information, and the receiver decrypts it by subtracting minus 5 from all the digits. But that's a simple method of cryptography. One-time passwords, very much prevalent. We all use while using such net banking and other aspects. Then we have firewalls. This firewalls is a very interesting one. In every institution, organization, we have firewalls so that it protects the intranet. See, there is internet, interconnected network, and we have intranet. That is the internet being used inside an organization, maybe by the organizational Wi-Fi or the LAN. So we have a firewall which protects the intranet from opening malicious websites. So we have an exceptional handling case. So in this case, we provide the firewalls with the information that this kind of websites cannot be opened from the organizational Wi-Fi or LAN. Then we have vulnerability analysis tools. So to understand the vulnerability of a website also, there are online tools available, pen test and all. And we have to know that how a website is vulnerable. What can be the aspects which can actually increase the vulnerability? What kind of database is in the backend of the internet website? Or there are various other aspects which helps in understanding the vulnerability of the website or any aspect, so that we can rectify them as well from before. Then we have air gap tool. In this case of air gap tool, what happens? Like, suppose there is a problem. Suppose there is a problem in a specific, computer, and it is connected to with various servers or various, it is connected to the main server of the organization. So we create a specific air gap. Okay, we try to isolate that, hardware or software or that specific part, so that it does not affects the other parts of the server or the organizational computers. Then we have defense in-depth strategy, multiple layers of protection. So this was the defense in-depth strategy. So we have multiple layers of protection so that the preventive technology occurs in a much effective manner. Then we have browser isolation. Suppose you might be aware of this dark web, that is Tor. In the Tor, we have onion routing protocol. Just like an onion, you see, whenever you open various layers of the onion, you get to see a new layer. So in the case of Tor, it is the portal to enter to the dark web. So obviously, Tor should never be opened normally in any laptop, because it opens the portal to the dark web. So obviously, many hackers are already sitting in Tor. So we need to isolate that browser and use it in a virtual way, so that, maybe through VPN or maybe a virtual machine, so that it is actually not connected to the main computer. Okay, and then we, use that browser by isolating it. Then we have detection technology. How we can detect if there is a problem, then how we will detect it. There are antivirus. We all use antivirus. Then we have intrusion detection systems. That is, we have IDS. So if any cyber attack occurs or it's going to occur, then there are nowadays technological systems which can actually understand the threat patterns and detect that if there can be an intrusion or not. And if there is an intrusion, that is, an attack has occurred, a penetration has occurred, then there is IPS, that is intrusion prevention system. It is like the Indian Police Service as well, actually. So it is like the intrusion prevention system. It's the, the preventive system to avoid the computer from getting hacked. Then we have malware sandbox system. Suppose a malicious code, a malware attacks into the system, then you might be aware of sandbox. So similarly, this malware sandbox system tries to, cover up that malware and again isolate it from the main system, that is from the computer, so that it does not affect the other parts of the computer. Then we have network traffic analysis. Just like, you have traffic here in Bangalore or any other part of the country, we have a traffic system, traffic signals. Why there are traffic signals? Just to maintain that there are no accidents or the minimum negligible accident, and the roads are properly used and the traffic can move properly. Similarly, we have network traffic analysis. In this, what happens? As we were discussing about understanding the patterns in the network and to understand the traffic, that is the packets, in internet, the information is travels in packets. So these packets are properly, communicated, and none of the internet data is having any malicious data or not. So this kind of network traffic analysis is also done. Now, let us quickly talk about the cybersecurity risk management. So in this case, what happens? This process focuses on identifying, assessing, and mitigating the threats to an organization's digital assets. So whenever we talk about risk management, we talk about understanding the risks, assessing the risks, and then mitigating it. Just like a strategy. When we build a strategy, we first formulate it, implement it, and then evaluate it. So in the case of risks, we first identify it. We detect the potential threats which can occur. For example, malware, phishing, or ransomware attacks, insider threats, data breaches. Okay, this kind of identification is done. Then we try to assess it. The risk assessment is done. That is, we evaluate the likelihood and the impact using various research and analysis methods. It can be quantitative, qualitative. For example, we saw in our previous practical exercise, which we did with Cyber Peace Institute, is that we saw what kind of attacks were there across the world, and we found ransomware was the maximum, was the most prevalent attack across the world in various pharmaceutical companies, medical manufacturing companies, and hospitals. So obviously, we can create a pie chart out of it, that just to show that ransomware is the major, cyber attack being done nowadays. Then we talk about mitigation, combating it. So how we can mitigate it? We can apply appropriate controls. We can have firewalls. We discussed it. We can have encryption methods. We can also have proper administrative policies, protocols, and training, so that we can train the employees to make them susceptible and aware about such cybersecurity aspects. Then we have physical access control. So what happens? Normally, what happens in a hospital or a pharmaceutical company or a health management institute or a health insurance organization or any company in the healthcare sector or any other sector, they have a proper mechanism to provide access to specific individuals. Normally, the database administrator get access to the database, and the cybersecurity officer get access to the cybersecurity aspect, so that other stakeholders only get access to the data they are authenticated to get access to, and the outsiders don't get access to any such data. So this is very important. Then we have monitoring and review. We need to continuously monitor for new threats, update our controls, and conduct periodic audits also. You might be aware, antivirus also keeps on getting updated with the recent virus which are there in the market, so that when the antivirus scans the entire system, they can try to get the list of all the virus which are there in the computer, and they can obviously quarantine it or remove it from the computer. Then we have incident response. What happens? Preparing a plan for detection, containment, eradication, and recovery from the security incidents is very, very important. So even if first of all we need to be have a proper preventive technology, but even if the prevention is not done properly, after that also the computer system should be ready to become stable again by eradicating that cyber attack or virus which has percolated into the system. Then we have various data security strategies. So it aims to protect the data confidentiality, integrity, and availability, as we already said, because security talks about the CIA triad. It's very important. Confidentiality of the data, integrity of the data, and making the data available also only to the authenticated users. Then we talk about data encryption. Obviously, we already discussed. So this was a very simple algorithm which we discussed of just subtracting with -5. But yeah, there are various strong hashing algorithms which can actually encrypt the data in such a way that only the sender and the receiver can actually understand the data. If a man in the middle attack, which is a term called, if someone tries to get access to the data while it is traveling from the sender to the receiver, even if he or she gets access to the data, he or she will not understand the data because it is already encrypted. Then we have access control, so which implements privilege access, so only provide access to the authenticated users. and also use multi-factor authentication. You can use it in while opening your Gmail account as well. And there are various other websites which are providing multi-factor authentication. You first need to provide the password, then an OTP, and then you get access to the account. Then you have role-based access. Based on the roles, you can provide access. For example, a patient might patient admitted in a hospital might only see the data regarding him or her, but not about other patients. But a doctor can actually get access to all the patients admitted under him or her. Okay. Then we have data backup and recovery. Very important. There is a saying that the show must go on, right? So even if there is a data breach or a cyber attack in any hospital or any company in the healthcare sector, a pharmaceutical company, then also they need to keep the show on. So what happens? There are nowadays a facility called data backup. So the database maybe can be stored in a local hard disk or maybe a cloud storage device, but another backup of that same data is being created in repeated timestamping or time intervals. Okay, so that even if the main database is hacked or breached by a hacker, the other database comes into the game and tries to keep the show running. That is, the tactical operations, the operational activities keeps on running in the company. Then we talk about network security. That is, I mean, we already discussed using firewalls, IDS, IPS, and also segmentation. That is segmenting the problem and then resolving it. That is divide and conquer. Then we talk about endpoint security, deploying antivirus, patch management, and mobile device management. So obviously, proper antivirus needs to be deployed, and we need to also understand that whatever patches, updates are coming, that is also free from virus. And we also need to ensure that the mobile devices connected through Bluetooth to any computer system are also managed properly as per the security protocols of that organization. Then we have security policies and training, because after all, when we are incorporating such kind of high level softwares technologies, then also we need to ensure that the employer aware about such concepts and they enforce data handling policies. And then we talk about compliance and auditing. We all talked about the various acts and laws and regulations, so we need to align with the standards as applicable. So let's quickly talk about the good practices which we need to ensure. Obviously, data protection and privacy is very important for any organization. So they need to protect their data and keep it private and only share it to the correct individuals who are authenticated. That also, if we are sharing patient health information, then we provide information or consent from the patient that we are sharing it with the specific body. For example, hospital is sharing the patient information with the health insurance provider. Then we talk about user authentication and identity management. So obviously, a user must be authenticated and then only can access to a website or the facilities of that website, and the identity needs to be managed. For example, someone else tries to get authenticated, then also there should be a proper identity management mechanism which can understand, no, this is not the authenticated user, but someone else who is trying to access the system. Then we talk about medical devices and IoT security. You might be aware of remote patient monitoring. We talked about smartwatches, wearable sensors, and Internet of Things. Very important because in hospitals, IoT and medical devices are very much used, and they are mostly computer controlled. So keeping those safe also is very important. Then we talk about data backup and disaster recovery. So if there is a backup of the data, then obviously even if there is a disaster, in this case a cyber attack, then also the show will keep running. Then we talk about email and phishing protection. So obviously, there are various good practices, like normally the institute or organization does not even allow to open malicious websites. And if a spam mail comes, then automatically it is sent to the spam box, not in the inbox. And then obviously, training the staff properly that please do not insert any virus affected pen drives or share any confidential information to any outsider or any individual who is not actually authenticated to access this information is very important. And then we make them cyber hygienic, right? And also we should secure the vendor and the cloud management. Suppose the hospital has a database which is in a cloud server, and that cloud server is being looked after by another company. So the hospital should make sure that the data which is going to be shared or being shared with that in that cloud storage and being accessed by the cloud service provider is a secured one, and they have their own, bylaws and protocols that they will keep the data safe and secure. So this is all from my side. Thank you so much for your patient listening. If you have any queries and questions, please feel free to ask. It's been a pleasure deliberating and discussing with you guys. Thank you.
Sir, we have a question. They asked what is Disha comparison between HIPAA and DISHA?
See, Disha Act is actually very good question. Actually, see, Disha is basically Digital Information Security in Healthcare Act. So basically, it is talking into the Indian context. Okay, this Disha, right? So it was actually, mainly started from Andhra Pradesh, and obviously it percolated towards the Indian legal aspects and atmosphere. So it is only pertaining to the Indian jurisdiction. And HIPAA is actually for US healthcare. And another good point, thanks for actually asking this query, is that in the case of HIPAA also, if you talk about the US healthcare system, suppose we discussed about GDPR, that if a company is in India but serving to the EU patients or EU citizens, European Union citizens, then also they come under jurisdiction of GDPR. Similarly, HIPAA also, if an Indian company or any other company which is not situated in US but are serving the US, patients or citizens, they're also coming under the purview. But Disha is actually for India, right?
Thank you,
Yes.
sir. So we have one more
Yeah.
question. What
Hmm.
kind of cyber
But
attacks are prevalent within the healthcare sector?
right. So it's a very good question again. I really appreciate. Acha, 1 second. I hope we have time, right? I mean, that's what my only concern. I mean, we can
Yes,
answer
sir.
it.
Yes, sir. Yes, sir.
Okay. Thank you. So, what type of cyber attacks, right, are in the healthcare sector? So, as we were discussing, I mean, we saw a very interesting, website called Cyber Peace Institute. So, there also we saw ransomware attacks are very common. Phishing is very common, and even social engineering. It has been found that various kind of social engineering techniques are also being used to actually get access to the system. Then data breaches. But yeah, normally, ransomware attacks are very common, and DOS attacks, denial of service and distributed denial of service, which are very common in the healthcare sector. And also, another interesting thing is that, as we were discussing, various kind of Internet of Things, devices or medical devices are also sometimes hacked, maybe with vested interests, maybe a big shot person, or maybe a person admitted in a hospital has many enemies. So obviously, a hacker might access to the remote patient monitoring system or the medical device also. Such kind of threats also occur. But yeah, ransomware is the most common one in the healthcare sector. Yeah.
Thank you so much, sir. We have one more question from participant. Why the
Yeah.
healthcare sector has become a major target for cyber warfare?
Oh, that's a very interesting question. So obviously, I mean, healthcare sector. See, first of all, we need to understand that health is wealth, right? So in this case, healthcare sector has become a very common one because people know that if they directly, the hackers hack into the healthcare sector-based company like a hospital or a pharmaceutical company or a health insurance company or any health medical device manufacturing company, they know that the ransom will be quickly paid because these are very sensitive sectors. So first of all, the value of data is very high. The medical records are containing various personal information. So if a person hacks into a hospital database, he or she, the hacker, gets access to the personal information also, like Aadhaar card or maybe the personal phone number and all, and also the health information also. So in one hacking mechanism only, he or she get access to multiple sets of data, right? Because it makes sense, right? A patient health information comprises of various kinds of data sets, right? So entire data set is provided and breached in a case of such hacking mechanisms. Then we also have live critical systems. Okay, in the case of when there is a disruption in healthcare, so it can have a life threatening consequence, which was actually witnessed in the AIMS cyber attack. you know uh, there was a rapid mismanagement which occurred when the AIMS cyber attack occurred. So, they now, in this case, normally what happens in the case of healthcare sector-based company, the victim tries to get things sorted as soon as possible. In other cases, at least you have some room for actually trying to mitigate and combat the hacking mechanism. But in case of healthcare sector, people first think that let's save the health of the people, because that is the main essence. And well, so then let's talk about the other things. Then obviously, another important thing, as we were discussing, is the outdated infrastructure. Pandemic has actually enhanced the IT infrastructure of various companies or organizations in the healthcare sector. So obviously, lots of scope is there to improve the cybersecurity landscape in the healthcare sector. Then obviously, rapid digitalization during pandemic, COVID-19 pandemic has actually, enhanced the IT infrastructure, the telemedicine portals, remote patient monitoring, digital records. But because of this rapid digitalization, what happened? The focus on cybersecurity was a bit lower during this quick transformation. But now the healthcare sector has also started using SIAM system, security information and event management, and other cybersecurity systems which can enhance the data security aspect of such companies. And obviously, if you want to talk about pharmaceutical companies, then there is a term called pharmaceutical espionage. Okay, so what happened? These cyber attackers, the cyber hackers, they target various pharmaceutical companies to steal the research data related to the innovative drugs. Okay, so what happens? They take a data set of a vaccine formula or a clinical trial, or maybe a randomized clinical trial results have been done for a innovative drug. They steal that results and then try to sell it to another pharmaceutical company, which is going to pay a higher amount, and then they try to sell that formula as well as the results, so that these companies can build up such things. But no offense to any company. Obviously, hackers have their own vested interest, and we need to be very much careful to avoid such cyber attacks. Yeah.
Thank you. So we have one more question from Ravi Kumar in the comment section. What healthcare organizations do when cyber attack happens, and what's the first step to recover data and protecting the other sensitive information?
Very good question. Okay, so what happens normally? What they do normally, first of all, they try to check the type of attack which has occurred. What happens, like if there is a ransomware attack, they try to connect with the the attacker, the hacker, and pay the ransom and sort things out. And if there is a phishing attack, then also they try to change the credential based information. And obviously, then they obviously start there with their own preventive mechanisms to get back the system into stable state. And as we already discussed, I hope you remember that we talked about two types of main storage systems, that is cloud storage and local storage. So suppose the hospital was running through a local storage, and this local storage got attacked. Then what happened? Quickly the hospital moves towards the cloud storage, so that at least the system remains stable and the day-to-day operational activities goes on. Because you can understand that it's a very critical organization. A hospital is actually admitting various patients, so the patients need to be taken care of. So obviously they need to quickly have some mechanisms which can keep the show running.
Zamir Ahmed has raised his hand, sir. Maybe he has a question.
Can I
please
go ahead if you're okay with this question?
Yes, sir.
Please ask, please.
Thanks for the presentation, sir. And it was a good presentation, covered most of some basic point. And I'll give my background. I'm from cybersecurity with more than 10 years. Okay. So why I have joined this session is to understand what it talks about in the healthcare industry for the cybersecurity. And I want to start a side I'm working as of now for the MNC and for the Europe client. So what I want to start parallelly along with my freelancing. Okay, gradually to start my own company and provide a cybersecurity solution or service to the healthcare industry. So can you please help me, or should I connect with you? Can guide me? How can I start? In this industry.
Definitely. Yeah, sure. What I'll do now, I'll just share my website. Okay, so you will get my details there, and you definitely connect me. That would be great. We can collaborate and learn from each other. I really appreciate. Yeah, I'll just share my website, and I'm sharing it to chat box only so that everyone can get access to it. I'm sharing my contact details there itself. Yeah.
Thanks for that. Thank you.
Yeah. I really appreciate it. Thank you. Thank you, everyone.
Uh,
Any more queries, please?
Nothing, sir. Thank you so much, sir, for your wonderful session and time. We'll
Yeah,
close the
thanks.
session, sir.